Hello, it's Dr. David Santos. So one of the things I'd really love to talk about is at what age would it be appropriate to really consider facial rejuvenation surgery? And I'm not talking about Botox and Juvederm and other fillers and that sort of thing. I'm talking about real restoration, rejuvenation surgery, brow lift, blepharoplasty, and facelift, neck lift types of procedures. And so traditionally, in decades past, it was always for those individuals who are in their 60s, 70s, and 80s even. But what we've seen in the last 15 and maybe perhaps in the last 20 years is a really huge decrease in the average age of those that come in to have facial rejuvenation surgery. In my practice, we have hundreds of patients that are in their 40s and even patients in their 30s and a rare patient in their 20s that seek out specific rejuvenation procedures. So I think what's real important is if you're in your 20s, the more common procedure that we do is liposuction, cervical facial liposuction. In your 30s and early 40s, a deep plane facelift, neck lift is very, very common. And then also blepharoplasty starts to sneak in the 30s and 40s. And as we get in our 50s, brow lift and facial laser resurfacing becomes more common. So it's just a ballpark estimate. The real thing that's important is the anatomy and the issues at hand. And those areas specifically can be addressed. And it doesn't really matter your age, although those are the common ages. So really the judgment is to have rejuvenation based on the potential improvement. And that comes from an excellent judgment from the experienced facial plastic surgeon.